Good afternoon, ladies and gentlemen. Welcome to Medcast new segments, where we bring you insights from top medical professionals. Today, we are joined by Dr. Ahmad AlBusairi, a dedicated family physician. From preventive care to managing chronic conditions, family physicians often serve as the first point of contact for patients of all ages. Join us today with Dr. Ahmed AlBusairi to share the importance of holistic patient care, practical health tips, and how family physician can guide you and your loved ones toward healthier lives. Welcome, Dr. Ahmed.
Thank you so much for having me. I
We are
appreciate
we are
it.
so pleased and honored to have you actually
Thank
because
you.
some people doesn't still know what is the importance of the family medicine.
Yeah,
So could you please tell us more about your important role in the healthcare system?
yeah, absolutely. So when it comes to family medicine and being a family medicine physician, uh, we play an integral role when it comes to seeing the patient first.
Hmm.
So we are the first point of the first point of contact, and the patient can come to us for anything.
Hmm.
So we deal with physical symptoms, we deal with the mental symptoms as well. We deal with ages from the pediatric ages to the elderly. We deal with acute cases. So if the patient have symptoms that have appeared for like a day or two, and we deal with symptoms that the patient has been having for, let's say, years.
Hmm.
So we deal with a variety of cases, and they don't need to book an appointment. It's a very walk-in clinic. So like sometimes your cases can be very like mundane and very simple, like giving sick leaves and stuff like that, but then you can also see the emergencies. So we are also the first point of contact when a person has like a heart attack,
Hmm.
or the patient has a stroke. So we need to be very careful, and we have to be very aware, because we go to work for that one case,
Okay,
for that one case that comes to you. Yeah,
that's very great. So your role is not like limited to giving sick leaves or only giving like Panadol or
exactly,
something.
exactly.
That's very great and very clear from you, Dr. Ahmed. In the developed countries,
Mhm.
the family physicians they have very important role in following up the diseases, especially within one family
Yeah.
or let's say within one region. But
Mhm.
I think somehow the people mentality here we have in the society are lacking this idea.
Mhm.
So how could we emphasize the importance of the family medicine in regards to follow up the diseases we have in the families and the regions?
Yeah. So for that question, I think there are like two sections for
Hmm.
it. The first section is that I don't blame the patients, because we don't have a dedicated system where the patient can choose exactly their doctor, and then they can still be with that doctor,
Yeah.
because we have residents like myself,
Mm.
and we can rotate from one center to another, and there's a high turnover of doctors.
Hmm.
So I don't blame them when it comes to not sticking with one doctor and bringing their own family
Mm.
and seeing that one doctor. On the other hand, we are always available,
Mm.
and we can always ask them if they want to follow with us.
Mm.
So the initiative and the first step can come from us first. So I always tell my patients that if you want me to see your parents, if you want me to see like your spouse or like your children, that uh, that like that I'm always available and I can always see them. It just helps build that connection,
Hmm.
and that's, I think, something that family medicine has that maybe other like subspecialties that they don't have, is that the connection that you can build.
Hmm.
So a friend of mine might know this family for 10 years.
Yeah.
So when you see them, it's a different kind of feeling, and there is such an ease of like an interaction with them. So this is something that I really actually enjoy about it.
No,
So
well, I think let's have like United Kingdom as an example.
mm,
They have a very proud system for the family medicines or family physicians.
yeah,
They are always like dedicating some families or even like in one small region, all
right.
the patients or all, let's say, the people of this region must go to one center who was having their file since ages, probably
Yeah,
since ages, sorry.
true.
And if they go to follow up regarding like a chronic disease, or if they go to follow up regarding a new disease they might have, they also have the family history and they will show them up that this is a result of having a family history of that disease.
Exactly.
Now, do you have any idea about the family medicine history and what did it start?
Yeah, so when it comes to the family history, like in terms of the patient's family history, in terms of
And
the medical
I mean in
conditions
terms of practice.
of the practice,
Yeah.
yeah. So family medicine, like in Kuwait, has been there for like a very long time.
Hmm.
It's one of the cornerstones of the medicine in Kuwait, actually. I think the first clinic was Beit Ma'rafi. I think
Yeah.
that started way back in the 60s or the 50s. And then we had the residency program, which kind of um, like
Improved a little
revolution.
bit.
Yeah, it's there was a total revolution when it comes to family medicine. So we've come huge leaps and bounds when it
Hmm.
comes to family medicine, and um, especially when you complete the board and when you complete the residency program, we are much more equipped of dealing with a variety of cases.
Yeah.
So I think we can deal with a variety of cases when it comes to like the family medicine, and we are equipped to deal with that.
So
Yeah,
to
for sure.
summarize, it's like you are a multidisciplinary team in one person
Exactly,
because you are following
exactly.
up everything. And one
Yeah,
of the important things you are following up is the, let's say, the genetic disorders, right?
that's
Now,
true.
how can that be important to the overall health of society?
Yeah, so I feel the genetic disorders can be maybe a very kind of specific group. So I might actually go a bit like broader,
Yeah.
and like I would say the hereditary like cases or the conditions. So like everything when it comes to cardiovascular disease,
Hmm.
diabetes, hypertension, dyslipidemia, um, maybe the autoimmune ones like the rheumatoid arthritis, the lupus. You can have also asthma, like as well. It's very prevalent here in Kuwait, and there's for sure a genetic kind of component to that.
Hmm.
So a lot of the conditions that we see, like here in Kuwait, there is a kind of genetic component to it. And I don't want also to like forget about breast cancer,
Yeah.
colorectal cancer.
Yeah.
There's a variety of cases that have genetic components to it, and it's our job to find out about the family history
Hmm.
so that we can make specific measures.
And we know that the easiest way to collect the data is to ask the patient himself, or sometimes to ask the family,
Yeah.
if it's like extended family or somehow,
Mhm.
let's say a big one.
Yeah.
But is there like any sorts of surveys you may make in one region so to explore what are the diseases that is prevalent in this area?
Um, to be honest with you, I'm not quite sure about the official surveys,
Hmm.
but what I do personally, like in my own clinic, is that I would always screen the patients if they have any family history.
Hmm.
So at least you can go with the first degree family.
Yeah.
So the father, the mother, the siblings. And then once you have that down, maybe you can go to the second degree. So the aunts and uncles and cousins.
Hmm.
And then if the patient has more information, that would be absolutely amazing.
Hmm.
But that's like somehow like sometimes that that's not possible. So if it's only the first degree kind of like family, that's more than enough. And we have dedicated sections in the system
Hmm.
where we can actually document that.
Hmm.
So we always encourage patients to share their like family history with us. Yeah.
Now, I think that would help you as well to personalize the care plans for each family, as
Yeah.
example. Is that possible during your practice?
Yeah, absolutely. So every single person that comes to the clinic, they would leave with a very personalized kind of treatment plan
Hmm.
because not every person is the same.
Hmm.
So, and that's the beauty about family medicine is that um, like we deal with the person by person
Hmm.
case. So it's never generalized. Okay, we might share the same advices. So it's like drink plenty of water or like get physical exercise, but that's very general. But then we can maybe like tailor that to a specific patient. So, for example, if a patient cannot walk
Hmm.
because they have like osteoarthritis, so we have to like change the plan a little bit, go swimming or like do the walk in the water. So it's not literally the same for every person, but you individualize the
And
treatment.
that also depends on the family history as well, as you have mentioned before.
Yeah.
And I'm pretty sure that we have so many more details to talk about the family medicine, but unfortunately, we have reached to the end of our segments. Hopefully, we can meet you again in our TV program.
Yes, absolutely.
Thank you so
I'd love
much.
that.
Our dear viewers, we have reached to the end of our segments with Dr. Ahmed AlBusairi. Hopefully, we can meet you again with another medical specialist. Until that time, see you later.